Welcome to the Psych Yourself Up Podcast. Today, we're diving into one of the most misunderstood and complex mental health conditions, schizophrenia. This disorder has been heavily stigmatized in pop culture, but the reality is far more nuanced and deserves compassion, awareness, and understanding. In this episode, we'll explore what schizophrenia is and how it affects the brain, the challenges and unique strengths associated with the disorder, how schizophrenia develops, and what factors contribute to it, treatment options, and how recovery is possible. Whether you're here to learn, support a loved one, or gain insight into mental health, this episode is for you. Let's get started. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. It often includes symptoms such as hallucinations, seeing or hearing things that aren't there, delusions, strong beliefs that are not based in reality, disorganized thinking, difficulty following a train of thought or speaking in a way that makes sense, reduced emotional expression, a lack of facial expressions or a monotone voice, cognitive difficulties, trouble with memory, attention, or decision-making. Schizophrenia does not mean split personality, a common misconception. Instead, it's a disorder that alters perception, thinking, and emotions in ways that can be distressing. Like any mental illness, schizophrenia presents real struggles for those living with it. Some of the most significant challenges include social isolation. Many individuals with schizophrenia struggle to maintain relationships due to their symptoms or the stigma surrounding the disorder. Difficulty with daily functioning, tasks like holding a job or managing self-care can be overwhelming without proper support. Medication side effects. While treatment is available, some medications come with side effects that can be difficult to manage. Misunderstanding and stigma. The media often portrays schizophrenia inaccurately, making it harder for those affected to feel accepted. These challenges can be overwhelming, but they do not define the person experiencing them. There is hope, and many people living with schizophrenia find ways to thrive. While schizophrenia comes with difficulties, it's important to acknowledge some of the unique strengths often found in individuals with this condition. Enhanced creativity. Many people with schizophrenia have vivid imaginations and artistic abilities, excelling in music, writing, and visual arts. Deep thinking. Individuals often engage in profound thought patterns, exploring abstract ideas and philosophical concepts. Resilience. Living with a challenging condition builds incredible strength and perseverance. Heightened perception. Some report an increased awareness of their surroundings or unique ways of seeing the world. These strengths remind us that mental illness is not just about struggle. There can be beauty and depth in these experiences as well. Schizophrenia is a complex disorder with multiple contributing factors. It doesn't have a single cause, but several elements can increase the risk of developing it. Genetics. A family history of schizophrenia can increase the likelihood of developing the condition. Brain chemistry and structure. Imbalances in neurotransmitters like dopamine and glutamate play a role. Environmental factors. Exposure to stress, trauma, or certain infections during pregnancy has been linked to increased risk. Substance use. Using drugs like marijuana, LSD, or amphetamines can sometimes trigger symptoms in people who are predisposed to the disorder. Schizophrenia typically emerges in late adolescence or early adulthood, though symptoms can develop earlier or later in life. While schizophrenia is a lifelong condition, it is treatable, and many people lead fulfilling lives with the right support. Some of the most effective treatments include medication. Antipsychotic medications help manage symptoms, though finding the right one may take time. Therapy, cognitive behavioral therapy, CBT, and supportive counseling help individuals navigate challenges and build coping strategies. Community support groups, peer programs, and strong social connections can make a big difference. Lifestyle adjustments, a stable routine, healthy diet, and stress management techniques improve overall well-being. Treatment isn't one size fits all, but with persistence and the right care, recovery is possible. Many people with schizophrenia find meaning, relationships, and even careers while managing their condition. Schizophrenia is a complex disorder, but it does not define the people who live with it. With compassion, treatment, and support, those affected can lead meaningful lives. If you or someone you love is struggling with schizophrenia, know that help is available and you're not alone. If you found this episode valuable, please like, subscribe, and share to help spread awareness and fight stigma. Thank you for joining me on Psych Yourself Up Podcast. Stay kind, stay curious, and remember, mental health matters.